Cork Today on C103.
And Anneliese Dressel of the Health Hub Times Square in Ballincollig joining us on this Monday afternoon. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome. OK, straight into questions. Catherine in Wilton was on. She's on what she describes as a low dose of a blood pressure tablet, but she feels that these blood pressure tablets are simply not agreeing with her. Is there anything herbal that you would recommend to lower blood pressure?
So there are a couple of things that may help, but the problem is that, having high blood pressure is quite dangerous, Patricia. It increases your risk of stroke. It can put your heart under an awful lot of pressure. So really having high blood pressure is not a great thing. So what I normally suggest to people if they don't want to stay on blood pressure medication is to remain on it while taking the natural medicines and see if things improve. And if the blood pressure goes down enough, then you could certainly think about taking less of your blood pressure medication or cutting it out altogether. So things that can help with blood pressure. So magnesium is probably one of the first ones, and that's very good because it helps the veins, the walls of the veins and the arteries to kind of be able to relax properly. Coenzyme Q10 is another lovely one as well because it just makes sure all the cells are working efficiently and it's providing them with the energy that they need to be in balance. Hawthorn is another lovely herb as well, which is very good for the health of the tissue of the veins and the arteries and the heart. So it's kind of got a circulatory benefit to it. And it's very good if you've got varicose veins as well. It's another lovely one for that because of its benefit for the tissue of the veins and arteries. And then probably the last one that's worth mentioning is the omega-3 fats because they actually can help make cells a lot more flexible. So the cells in the blood vessels could be more flexible, but they also thin the blood. So it's much less likely to be sticky and harder to push through the veins. It'll flow beautifully. So a good omega-3 fat, and you want one that has at least 1,000 milligrams of fish oil in there with both EPA and DHA. They're the two types of omega-3. But the EPA is a lovely natural anti-inflammatory one, so get one that favours more of that rather than the DHA.
OK, Mary is in Newmarket and she describes she's a problem with her balance. She's been to the doctor who says it's something to do with her ears, but she's never been given anything for it. Now, she said she's been suffering from it for a number of years and she describes it as it being very hard to go upstairs because her balance is kind of off.
Yeah, that's a very difficult one now, Patricia, if it's been going on for a few years. So there are certain things that can affect the inner ear canals which are responsible for our balance. There'd be two, like COVID definitely for a lot of people ended up with either tinnitus or vertigo after COVID. But there is a relative, the flu virus that causes, it's called vertigo, and it is a viral infection of the inner canals. And this inflammation can last for some people and can cause tinnitus or dizziness or loss of balance. I think when it's gone on for a couple of years, you probably need to do a little bit of balance retraining. There is a clinic down in Middleton. The name doesn't come to me straight away, Patricia, but if people were to actually Google physiotherapy Middleton and balance retraining, it's very good for vestibular migraine as well, which is, again is a migraine type of thing that is more about affecting your balance than pain in your head. So that probably would be a good suggestion. And if you take natural anti-inflammatories and antivirals, they can help. But my worry for this lady is that it's gone on now for 3 years, that something like that won't work for her.
OK, I've just Googled it, and is it the East Cork Physiotherapy Balance?
That's the one. Yeah,
and they do an acupuncture
clinic.
clinic.
Yeah,
and actually they're on Facebook if the listener wants to check that out. Sheila's been on. Hi, question for Anneliese, please. I have been taking Piriton to help me sleep, but now I find I can't sleep without it. I'm wondering, is it addictive? And if so, can you suggest something more effective but a non-addictive solution? The only other tablet I take is a blood pressure tablet.
Yeah, and sometimes, Patricia, if people are going through a very temporary sleep problem, I would recommend taking those antihistamines because they do make you drowsy. So it's not necessarily that you've become addicted, but they just haven't solved your sleep problem. So sometimes it can work because people will just get into a natural cycle of sleep again and they will be able to drift off naturally. But in this case, that clearly hasn't restored a proper sleep cycle. So trying to use natural supplements, they are lovely because they do kind of work not to knock you out like the Piriton, but actually to restore calm and balance so that you can have a natural sleep. And they're very, again, non-addictive. So the best one I think that we sell in the shop that we get the best feedback on is the NHP Natural Health Practice. And they do an advanced sleep support. Actually, we're doing it at 20% off at the moment, and it really is very, very good. It's a blend of nearly everything that can help with sleep. So that will be one thing to try. Some people find valerian is very good. It's a herb, again, that just promotes total calm and focus. So you could get that. Vogel does a Dormazan tincture and tablet that you can try with that. Other ones, some people find the magnesium bisglycinate is very good. The glycine part of it is great for sleep, and the magnesium is great for calming. So some people find that would work. But I think your first port of call in this particular case here would be to do the NHP Advanced Sleep Support, because it's got a little bit of everything in there.
Okay, Lorraine has been diagnosed as perimenopausal at 36 years of age. She's suffering from very heavy periods, but feeling very washed out and tired, even after a full night's sleep. What would Anneliese suggest?
Yeah, so it's like anybody really who's perimenopausal. You can either go down the HRT route, which maybe her doctors have spoken to her about, or she could go down the natural HRT route. So there are plants that have estrogenic action in the body. They mostly come from lignans like linseeds or soya, and they generally for natural supplements they get extracted into high amounts so that you get a high extract. And they do have estrogenic effects, so they can really help rebalance the hormones. One of the problems about early menopause is estrogen has such a protective effect on our bones. So if you've got early menopause, your chance of developing osteoporosis down the road would be much higher. So in this case, I definitely would recommend a vitamin D3 and K2 supplement for the bones, just to make sure that you're utilising the calcium in your diet. So in terms of the menopause supplements that work the best, I suppose the one that, and I've used it myself and I find it great, it's the Nutri Advanced Perimenopause, Mega Mag Perimenopause. Revive Active actually do Menopause, Amenoactive, I think it's called, and I've tried that. That's actually very good as well. And then some people will do better on simpler ones like maybe Dong Quai, which is a Chinese herb that has been used for many, many years. And if it's very, very bad, if your symptoms are very bad, sometimes going to a herbalist, they can make black cohosh. Unfortunately, it's been taken off the list of things that we can sell, but a lot of people get a great benefit from black cohosh as well. So I would start off either on the Menoactive or the Nutri Advanced Mega Mag. And in terms of the very heavy periods as well, you could maybe add something like Agnus castus in, which is a lovely herb for anybody who's got very heavy periods, albeit perimenopausal, albeit PMT and premenstrual tension and disorder. Agnus castus is a great herb that can help regulate that. And of course, always the omega-3 fish oils, if the periods are very painful, they can help make the blood a lot less clotty and thinner, so it's not as likely to be painful.
Okay, Emily's 10-year-old son suffers very badly from constipation. She said he's always suffered, even as a toddler. He eats a very healthy diet, but he's not good to drink water. And she's wondering, could that be part of the problem?
Yeah, definitely. When I hear, though, somebody has always suffered from constipation, it's a red flag for me, Patricia, for a food intolerance, because most people think that IBS is diarrhea, but in actual fact, most people who have IBS have severe constipation. And a young kid that eats very well, plenty fibre and is active, the only other thing, if it's not food intolerance, could be absolutely dehydration. So you could figure out ways of getting the water in, like you could make lollipops with juice. You could add more grated vegetables and grated fruits. Sorry, Patricia, like pear and apples are wonderful for constipation. Into breakfast cereals or into a smoothie, and water, of course, will be in the fruits as well, and you can get it in with the smoothie. Sometimes even just adding some type of like my wadi thing to the water will persuade them to drink it as well. So I'd say the first thing to do here would be make sure they're drinking, the little fella's drinking loads of water. And if that doesn't resolve its constipation, it probably is food intolerance, and then you'll have to go down that route and investigate that. But meanwhile, natural supplements for constipation, psyllium husk is one that's very easy to hide for kids. Now, it does go a bit gloopy, so it's best hidden in things like ready brecon porridge. It's great for adults, and it helps to soften the stool so that it's not as hard and much easier to to push out for kids, because if they feel pain, a lot of the time that can cause them to hold as well, and that's another problem to conquer. So psyllium husk is very good. In terms of the fruits, pears, prunes, and stewed apples and kiwis, they would be the top 4 really. And then if you wanted to do a natural laxative for a kid, like something like the Otis fibre cubes, they're kind of fruit cubes of figs, that's very good, or syrup of figs is very good, and you could also use aloe vera juice.
Okay, and somebody's looking for information about vitamin D now that the dark evenings are in. How much vitamin D do you recommend taking, and should everyone in the family, including the children, take it?
Yeah, I think everyone in Ireland should take vitamin D at this time of the year, definitely. Like Patricia, in olden days, the animals used to be outdoors, and when we'd eat the animals, we'd get the vitamin D. But like even in the summer months, these animals don't get any vitamin D. Like pigs and chickens are indoors all the time. So any pork products, any eggs, anything like that, they're going to be totally deficient in vitamin D. And then in the winter months, when we need vitamin D the most, because we can't get it ourselves from the sun, the beef cattle are indoors. So I think and especially if you're not a meat eater as well, or if you don't eat a lot of dairy, I think it's very, very important. Now, the $1 million question is how much. So I think err on the side of caution. I think 1,000 IUs is probably sufficient for all adults. 400 IUs is sufficient for kids. Unless you know that you've had your vitamin D tested and you're too low, because taking too much vitamin D can increase the rate of calcium absorption, and then too much calcium can actually cause hardening of the arteries. So everything in moderation in life and nature. So I think 1,000 IUs, plenty for all adults, 400 for kids, and don't. And if you wanted to give it a break actually as well at the weekend, Patricia, it would allow the body to catch up if you're giving yourself too much.
Okay, and one very final one from Margaret. It says, I'm on an antibiotic for a chest infection. It's my second prescription and I don't feel I'm getting any better. Not very sick, but it's a lingering chest infection. I feel at times I may be coughing up the antibiotic. Any suggestions, please?
Yeah, actually, it's a very common problem, Patricia. Like we are becoming antibiotic resistant a lot of the time, and people think it's from taking them. Actually, it's mostly because it's in our food. It's given to animals that are kept indoors. So I hear an awful lot of people at the moment saying they're on their 3rd and 4th antibiotic for chest or for kidneys, which seems to be rife as well at the moment. So there's lots of things you can do to support yourself naturally for a chest infection. The first thing I would definitely recommend is the Dr. Dealish Clare Mucotone, which is disgusting but fantastic. It's a herbal blend to boost the immune system and also to kind of help reduce mucus in the chest. And I would take that now at the moment for treatment. The second thing I would take is something called NAC, N-A-C, N-acetylcysteine, its long name. And some people find that it literally is just gets rid of their sinus if they're prone to sinus in the winter. Lots of our customers who were taking it post-COVID actually noticed that they didn't get as bad hay fever. Some people didn't need to take any antihistamines in the summer either. So that's definitely a good one to add as well. And then if you've got a lot of phlegm stuck in your chest, the best thing actually for that is carrageen moss. And if you don't want to go to the trouble of cooking it up and boiling it yourself, there is Comvita. They do a cough bottle with manuka honey and carrageen in it, and it is very good to kind of get that mucus up and out of your chest.
Okay, as always, a mind of information. We'll chat next Monday, Anneliese. Thank you for that.
Thanks, Patricia.
And thanks for joining us. That's Anneliese Dressel of the Health Hub, Times Square in Ballincollig.